Hello and welcome to another episode of In Focus, a live panel discussion brought to you by the Barbados Government Information Service. Today's topic, breaking the stigma, mental health in the Caribbean. I'm Sharifa Medford-Gilkes and I'm happy that you could join us for this very important and timely conversation. Mental health touches every one of us, whether through personal experience or the people we care about. And yet, for far too long, it's been treated as something to hide, something shameful, or simply not as important as physical health. But the truth is, anxiety, depression, PTSD, burnout, these are real challenges, and they deserve real attention and compassion. And that's exactly what we're here to talk about. We're going to explore why the stigma around mental health still exists, how it shows up in our communities, workplaces, and even our own thinking. And most importantly, what we can do to change it. Joining us for the first half of today's conversation are three individuals who have been working to raise awareness, two of whom have also been navigating their own mental health journeys. Robert Croizat, mental health advocate and retired financial professional. Shane Phillips, community mental health motivator, and his Instagram handle is at beautiful_minds246. And Ryan Lewis, nursing officer and mental health program coordinator at the Barbados Psychiatric Hospital. But joining us later to tell us about local and regional efforts at the governmental level to dispel the societal pressures and cultural myths that too often keep people from seeking the help they need are Minister of State in the Ministry of Health and Wellness, Davidson Ishmael, and Advisor Health Systems and Services with the Pan American Health Organization, PAHO, Dr. Vishwanath Pratap Singh. But first, gentlemen, welcome, and thank you so much for being here with us tonight. Let's get right into it. As you know, we've been chatting before, and Ryan, you've been singled out as one of the persons that have been constantly, daily working on breaking the stigma and educating others about mental health. Tell us about your job, some of the activities and programs that you are working with to help persons with mental health challenges.
Well, first of all, thanks for having me here and to speak on a topic that I've been silent for far too long, and that is about mental health and mental illness. And my work of last year, especially when I have been given the opportunity to lead the Check My Bias Anti-Stigma campaign, we have been going at great lengths to break and dismantle stigma in Barbados, of course, and the change in society. To get persons to understand, first of all, what is mental health, the difference between mental health and mental illness, and of course, why we should not silence ourselves into shame or into quiet corners, and to take this conversation from being taboo to more open, because let's be real, mental health is all of us, and all of us have mental health. What all of us don't have is mental illness, but often between our personal life experiences, the changes that we have to adapt to, even reference COVID, can really easily push any person into having a mental health challenge, and if left unattended, can easily develop into a mental illness. So we are urging persons to be personally honest of their life experiences, set aside the cultural differences that kind of perpetuate stigma, and this comes as far as from our colonial ties. We have been so resilient in toughing out situations that we have silenced ourselves that we need to push our experiences under the carpet. But we're saying to you, talk about your experiences, and there's more strength in becoming vulnerable, in sharing your story and your experiences. It doesn't make you any less of a human. It doesn't signify that there's a personal weakness. As a matter of fact, speaking about your experiences is a sign of strength. And we want persons to understand that the more we talk about it, the more normalized this conversation becomes, and persons start to realize, hey, well, I too have a similar situation, and then let that be a contagion as opposed to persons suffering in silence, and then they reach health centers or their health-seeking behaviors only become engaged when they hit crisis point. And of course, this mental health campaign is about leveling the playing field, getting persons to understand that mental health is real in the first instance, that mental health exists in schools, it exists in the workplace, it exists in communities, it exists in homes, and there's nothing to be ashamed of. And because of that, we humanize the efforts. It's a shared experience, and that there's no shame in seeking out help or going in a room that is labeled psychiatrist, psychologist, or mental health clinic. The main thing is that persons are actually getting help for their situation. Just like you go to the dentist, just like you go to your GP, just like you go to a clinic for flu or for a cut, you can easily go to a mental health clinic for any situation that is really threatening and challenging your mental health on a daily basis. Because we want to keep families together. We want to keep you in schools. And we want to keep you at work. We want to keep you as productive citizens. So, I mean, let us just be real and say, you know what? Mental health is health.
Okay, well, we have two advocates here, and I'm sure that they have also been working tirelessly to get the message across. Can you tell me, Shane, what would have propelled you to make that step to be more vocal about mental health?
My journey started about 24 years ago.
Wow.
That's the first time I experienced depression. And it started after I had a physical injury, had a surgery, and then after that, I became very depressed. And along that journey to wellness, I was able to get help where I reached out to the clinic at the hospital at C4 in QVH, and I was gone for assistance. And after that, I was maybe for about 2 years. After that, I was experiencing on and off bouts of depression and still not really able to deal with it. And then I got medication. I've been getting medication for the depression, but then I had like a high, which kind of like offset your mood. So then I would get diagnosed with a mood disorder. And at first it was hard to accept because you feel as though when I went for help and I get a diagnosis and you kind of rebel against it, which is a natural feeling that anybody would get if you went seeking help. But then as time went by, you mature with the feeling, because I was quite young then, in my 40s now, but when I started to realize, you know what, maybe if I try to understand me and what it is that I'm battling with, maybe I could be able to function a little better. And then I started listening to a lot of inspirational stuff, like about with like Dale Carnegie and the different, or Nightingale and different people like that. And also doing research on other people in society, like prominent people in the world who are suffering with had the same challenge. I wasn't suffering, but had the same challenge that I had. And using that information to be able to boost me along my journey. So as time went by, I started to meet other people who I realized that a lot of people dealing with stress, they're dealing with depression, they're dealing with anxiety, and I realized they're real far-reaching society, but they want to go for help. Because everybody's like, I can't go and sign in myself to the hospital, I can't go and do these kind of things, looking for help. So I said, well, I will start a community, which this is in 2023 now. I would have started a community. The anniversary of it would be the 24th of May this month. Saturday would be 2 years I would have started it. It's not a very big community. I was like about 20 persons in it, but it's a group of people who actually have psychiatric illnesses and stuff that they're dealing with. But I try to help them see, well, it's not what you're diagnosed with, it's how you function. So I purpose in my mind to function at all costs to show that you can live a normal life, or what we call a normal life, because it's like everybody can still be faced with challenges. Life is having challenges straight up, but at the same time, other people might go over the limit now in terms of what you are, the average person will be experiencing if you don't have a psychiatric diagnosis. But in terms of mental health now, as Ryan said, there's a difference between mental health and mental illness, where mental health affects everybody. Some people might be predisposed or after the fact have a mental illness. So it kind of encouraged me to tell myself, you know what, I gotta get out there and like just show people it's not what you're diagnosed with, it's how you function. And just try to function as best as you could. Don't be afraid to reach out for help. Find out information about what you might be dealing with and just empower yourself. And then the other thing I told myself is I can't believe a prediction that does not empower me. So for mental health, I would say I came up with this thing with IME, which is inspiration, motivation, and encouragement, which is the three main things I would use to like foster my own strength and resilience. So the inspiration, you look and you see somebody coping with a situation that you might have been battling with, then the motivation coming from within saying, well, you know what, I could set a goal and work towards this. But without encouragement and support, as Ryan said, that might not work for you because you need the encouragement and you need the support. And it can't just come from within the household or within friends, because they might not be equipped with the knowledge to be able to tell you, well, okay, I feel that you should do X or you should do Y or you should do Z. And some people might shift you to like just avoid it because they might tell themselves, well, man, I don't feel that I can associate with Shane because he diagnosed with a psychiatric illness or whatever. But at the end of the day, I think that overall, seeking help is the most important thing. That's the most salient thing that I get into. If you feel like you don't feel okay, it's okay to not be okay. And it's harder, I find in my group, it's harder for the men in the group because they leave the group and stuff because like they don't be able to cope because society, as Ryan says, you're telling yourself, well, when you're a man, you gotta be strong and you gotta harness this thing, you gotta support. And then for the most part, men is telling yourself you gotta be the breadwinner and you gotta provide for the family and got this pinnacle of strength. But sometimes you just don't got that strength sometimes to be able to cope. So like I told myself from day one, I can't accept this and tell myself, well, there's the end of the road, because having a mental health challenge is not the end of the road. You could always get past it. So you could live a whole lifetime either suffering or you could seek help and just live a life.
Well, we're going to get into your story a little more as we go on. But Robert, I would like to hear how your experience has pushed you then to actually share a message with other people.
Yeah, so I was feeling, about 10 years ago, I started to feel stressed at work. And just as Shane was saying, I did the typical man thing. You know, it's like, I can't show any weakness, suck it up, deal with it. But what's often forgotten is that, you know, we're all human beings in human bodies, and our bodies and our minds have limits. And if you push beyond, if you don't seek help when you need it, something's going to break. And in my case, it literally broke, and I had a breakdown. I was admitted to a psychiatric hospital in the UK, diagnosed with severe depression, severe anxiety. It didn't have to be like that if I had, as these guys are saying, sought help earlier. You know, I saw the signs and I ignored them, and as a result, things got worse. Thankfully, I recovered fully, but it took 6 years. Because of my experience, you know, I now feel almost compelled to kind of shout from the rooftops. You know, one, let's all be aware of mental health, and two, let's fight the stigma. You know, let's talk about it. You know, the more we talk about it, the more normal it becomes to talk about it, and the stigma reduces.
Okay. Have y'all encountered many challenges as you've been trying to get people to actually come out of their shell and share their stories in order to get help?
Yes, definitely. In the beginning, I mean, we are way better than we were when we first began. But in the beginning, persons were very timid and shy about sharing their stories and accepting that even mental health was real. I remember one time I was doing an outreach activity and I asked a lady if I can speak to her about mental health. And her response was quite alarming, and she just said, no, I don't have mental health, I don't have mental health. And that presented the first dichotomy for me, and that's why I say we need to really separate, or distinguish the meaning between mental health and mental illness. Because what she really meant to say is that she didn't have a mental illness, but all of us do have mental health. And we kind of shy away and push things under the rug when our vulnerabilities have to become exposed. And again, it pushes us to the realm where you don't want to like air dirty laundry, so to speak, in Beijing Paraline. And I mean, we can be open about certain things and we can be cautious about it. But what we need in society for that to be realized is that we need to create safe spaces. Because let's be real, when we open our mouths and say when we are not well in our society, in our Caribbean society, people usually tend to weaponize that information and use it against you. And then it kind of results in loss of opportunities. So you don't get a job, some people don't want to admit you into schools, or they don't want to sit down next to you because they fear you. And this is where stigma raises its ugly head, because stigma permeates and continues because of fear and because of ignorance, in the truest sense of the word. When we don't understand something, we create a narrative that is usually false about it. So persons have these myths about persons with mental illness, that they're dangerous and cannot be trusted, or that if they have a diagnosis, that they have it for life, and that if they go to the psychiatric hospital, they're going to come out looking like zombies. People had their own societal nuances and understandings of what we do at the psychiatric hospital, and if you start taking medication, you just have to take it for life. treatment does not begin with medication. Treatment begins with conversations, and that's where change occurs. If you can speak about our experiences, where we can really debrief our traumas, debrief our griefs, debrief our life experiences, and talk about it, make sense of it, and come to the realization, you know what, yeah, that was an awful experience, so how can I do better? How can I inventory what I felt? How did my body respond? Is it affecting my sleep? Is it affecting how I eat? Is it really distracting my thoughts, my ability to focus on work, or on school, on my family? Is it impairing my relationships with my loved ones? And to really interact, am I incontinent of my emotions? Am I becoming quick to anger? So we are seeing a change now, because I've seen some experiences in persons in society that have been recorded by cell phones. And what really warms my heart is the outpouring of love and consideration for humanity, where persons are saying that no, mental health is real and that we don't understand it and we need to do better as active citizens in Barbados. And quite recent, there was a gentleman that took to social media and sharing his story. So we are seeing a contingent of persons now building up confidence to share the story and normalize this conversation without the prompt, which I still believe is still following from the active campaigns of the psychiatric hospital, which I'm grateful for, that persons are now finding that confidence to speak up and speak out and seek services. And anecdotally, we've been seeing persons actually calling to say, you know what, I want to make an appointment, I want to come to the clinic, how can I really get into it and explore what my options are? So we've been seeing a change, but we're still not quite where we want to be as a society, but I think we're on the right trajectory.
Because you mentioned the stigma, and Shane, you would have mentioned it in your introduction as well. What is that like, your interaction with people? Now, especially that you've been so open about, you know, what your experience is. How has your interaction with people been? How are they reacting towards you?
Well, to be honest, I never had a problem in terms of like speaking to people about my diagnosis or my experience or whatever. Most of the time I meet somebody, it could be for the first time or be just in a conversation. I just be quite open about it because I don't feel shame about the situation. It's like being diagnosed with diabetes or high blood pressure or anything. It's just a case where it's just one is mental, the other one is physical. But at the end of the day, I never had a bad experience. I never met a single person, to be honest, that I have told them about my situation. And for the most part, somebody would say like, you know, you experienced that too. And I'd be like, you experienced what? They tell me, when I sent myself to the hospital before or whatever, and like, I started to realize that so many people in society from all walks of society are experiencing things. And that just gave me a little comfort to know, like, okay, so if these people are willing to open up to me, maybe I might be able to do something to help. Even if it's something that I can't physically tell you to do, I may be able to encourage you to go and seek help at the hospital or any other place, because it takes a lot of courage, but at the same time, it's courage and self-respect. You understand that you're giving yourself when you do that. When you make that step and say, well, it's not a case of weakness. When you make that step and say, you know what, I am going to go and seek help. Or other things that happen to us, like people be encouraged by the fact that, like, well, if I meet Shane, I never would think that he had a problem or ever had an experience or whatever like that, because it's mostly be the same way all the time. But I had my highs and my lows and a lot of experiences I would have gone through, but the journey was rocky. I learned a lot through trial and error, a lot more error. But at the end of the day, I think that for me, meeting people and stuff like that, I never had a problem. Like actually a lot of the persons that I have met that I hardly knew are part of my support group now. So even the people in the community, I have the community set up, You Are Not Alone, which is my WhatsApp group. But it's not, as I said, it's just a small group, like people that I would have met that I saw either at the hospital or wherever, and they asked me to add them to the group, or somebody might call me and tell me, well, I got a friend I want to get added to the group, and we'll call them up, find out what's going on, see if it's somebody that actually that could benefit from being in the community, because it's just a safe space where you could come and say, well, like, say you had a bad day today, or something real terrible happened. There's be a lot of extremes, but we try to send little positive messages every day. People might put a little meme or something to try to encourage each other, but I never had a problem with it at work or anything like that.
What about you, Robert? What was your experience been like with other people who have known your story?
Yeah, I think it's incumbent on me to be honest and to talk about my experience. And I find in doing that, it gives other people confidence to talk about their experiences. In other words, if if you kind of lead the conversation and say, hey, I've been in a really bad place, other people feel more comfortable to say, oh, well, actually, yeah, I've kind of had something similar myself. And that's really, it's all about getting the conversation going. And then when people are talking about it, actually, it wasn't that bad talking about it, so maybe I can talk about it more and talk to other people about it, and that it kind of snowballs from there.
Would you say that pride plays a role in people not speaking up? I mean, are people too proud to admit I have a problem?
Pride, yes, but I think it stems more from the societal expectations of what quote-unquote normal is. When you hear conversations and when you hear a person saying in society that this is how a normal person should act or should think or should do a particular thing, but you have an alternative viewpoint that is kind of juxtaposed to mainstream understandings, then you don't feel confident. You start to wonder, wait, am I the problem? Because society said that I'm supposed to be this way, but I don't find myself aligning with this particular way. So then that pushes you into silence because nobody really don't want to be singled out. A lot of times persons don't want to be spotlighted because of a particular thing, especially when it is viewed as something negative. And that's the basic definition of stigma, those negative attitudes, the discriminatory and disparaging comments, because of that difference that you have as an individual. If you look different, if you sound different, if you are not, we have our definitions about what beauty is, about what size a person should be. And stigma kind of lends itself to organized society based on these differences. So it makes you seem as if you're the person that have the issue, as opposed of the issue actually being the issue. Okay. So if you...
We actually have a question. Sorry to cut you.
Okay.
And we're thanking the audience for your questions, and we're encouraging you to send in your questions and comments because we have the advocates, we have the professional here, and they can answer your questions for you tonight. What can employees do when their concerns about mental health are dismissed? And this is from Works Matters.
Well, I often quote the SHAW Act, which is the Safety and Health at Work Act. And any department that has 25 or more persons should actually have a health and wellness committee. And I often believe that health and wellness committees is that avenue that persons can change the working environment for which they want it. Not every workplace is going to have a mental health champion. And I still do implore bosses, supervisors, CEOs, managers to be mental health champions, because by virtue, you are the role model for the workplace. But if that is absent, if you don't understand what mental health is, your behavior and the work environment is going to be surrounded on that leader's belief. So if that is absent, I'm saying generate and quote what is constituted as law to have that health and wellness committee, and use that as an impetus to change the work environment to what you want it to be. So then you can start having health and wellness initiatives, things like agitating for whether it's flexible work arrangements, whether it's taking breaks, making sure that you get your time, because we got to understand that the workforce are humans first. Their mothers, their fathers, their sons, their daughters. And throughout life, you're going to have transient and these situations that are going to cause you to adapt. You're going to have an ill person at home. You're going to have new expectant parents, which is going to cause a change to your personal life. And it's going to cause you to adapt to these changes. So because you can work late, it doesn't mean that you're going to be a habitual late comer. It's just that there's this particular change at home that is causing you to be late at this particular time. So have a conversation safely and say, well, I'm having this situation going on, can I? And then have that conversation. The other thing about it is that I do urge, depending on the size of the corporation, to have mental health pathways or health and wellness pathways. In the government, there is the employee assistance programs, where if you're having a mental health challenge, that you can seek that, and you can have up to 3 sessions within a calendar year. Depending on the nature of that particular circumstance, then they can make arrangements to have that extended and seek out help. The thing is about seeking out help, because your success as a business depends on a mentally healthy workforce.
Okay, Robert, are you seeing this within your workplace?
I no longer work. I stopped working earlier than I ideally would have done and it was due to stress and my mental illness. But I fully agree with Ryan, and we've talked about this a lot, that it's important for employers and managers within businesses to really be supportive in terms of employees, not just because it's the right thing to do, and it's good to care and show that you care about your employees, but it's also good for the bottom line in terms of the business, because businesses are there to make a profit, and therefore for that to happen they need a productive workforce. Now, isn't it better to support someone who's struggling with their mental health, perhaps stress at work, early on, rather than not give support and you end up losing that employee because they can no longer work, or they're taking a lot of sick days, and you may have to replace them, and you've got the cost of rehiring, retraining. You know, it makes far more sense to a company's profitability to act early and be there for your employees.
Okay, are you seeing this support as well?
Yes, for sure. At work, we have the employee assistance program. You have something named paid time off, where you have up to, I think it's like 52 weeks in a year. You can ask for time off with pay. So if you speak with your manager or whatever, you going through a little crisis or you need a little help, you could get the help from the employee assistance program, which allows you to see a psychologist, which I benefited from. I went through that, and then also the flex PTO, the way that works, like you could get the time off from work if you need it, and you would still get paid, even if you just need to like recap, just to refresh or whatever. So we got a good support system where I work, but I would say we don't have that problem, to be honest. I'm not saying that some people might not be still under stress, but at the same time, stress comes with work. So it's just having that outlet still to be able to go and see a psychologist or therapist or whoever you need to speak to. We have that. So it benefit from that. I give God thanks for that, to be honest.
Okay. Well, the conversation is definitely interesting and educational. We're going to take a short break here, but we encourage you, our audience, to continue to submit your questions and comments. We will address them a little later in the program. And stay tuned as we continue to push past the myths, challenge the norms, and advocate for a real change in how to address mental well-being.
Hey farmers! Now you can access our farms right from your phone, tablet, or computer. Just visit agriculture.gov.bb. Go to resources and click download form. There you will find many of the forms you need, including incentives and rebate. And it gets even better. These forms are fully fillable. No printing, no hassle. Just type, save, and submit. Your requests get processed faster, saving you time and effort. So why waste a trip when you've got better things to do with your time? Go online today and get it done from the comfort of your home or farm. Visit agriculture.gov.bb, click resources, and download your form now. It's that easy.
We often believe that if we go to a further location to get an item that is cheaper by a few cents or $1, then you have actually saved money on that item. That is correct. But unfortunately, the distance that you've traveled that is further away from the more expensive item may actually be extra money that is spent, may exceed the money you're saving. So it may actually be better for you to buy an item that is $1 more expensive that is near to you than driving and spending an extra $15 just to save $1.
Conversations, the podcast where we discuss the topics that matter to you.
From real stories to real talk, we dive into everything. No filters, no fluff.
We're talking about the issues you actually care about. Finance, mental health, sports, entertainment, and so much more.
It's not just talk. It's conversations that bring us together, challenge us, and keep it real.
Don't have time to watch? No problem.
Just turn on the video while you're cooking and we'll keep you company.
Listen on your morning commute, while you work out at the gym, or even when you get home on evenings and chilling out.
Wherever you are, however you listen, this is your space for real conversations.
Join us.
Join us.
Just a conversation.
Available on all streaming platforms or wherever you get your podcasts. Follow us on social media at GIS Barbados to share your thoughts or to stay connected.
Skip the line, stay inside, and pay the easy way online with the Pace Digital mobile app. Now you can pay for your renewed license, police certificate of character, and more via the Easy Pay Plus platform with the Pace Digital mobile app. Log into Easy Pay Plus, select the service, and confirm. Select the Pace Digital mobile app payment icon for your QR code. Open your Pace Digital mobile app and select the Pace Digital Pay tab. Scan the QR code and confirm your payment. Visit us online to learn more. Don't have the Pace Digital mobile app? Download it today.
Thank you all for being part of this conversation so far. We've seen your questions and comments, and now that we have our additional panelists, we will be sure to answer as many, if not all, of your questions. Joining our panel are two health officials who bring expertise on the topic from both government and healthcare perspectives. Minister of State in the Ministry of Health and Wellness, Davidson Ishmael, and Advisor Health Systems and Services, PAHO, Dr. Vishwanath Pratap Singh. But for tonight, we're going to call him Andy. Okay, welcome and thank you for joining us tonight.
Welcome.
Okay, I'm going to pose my first question to the Minister. What are the national policies, or are there any in the works, to address the stigma and the other challenges surrounding mental health, illness and mental health?
Well, thank you so much for the opportunity to be here. This is a very important conversation that we're having. And actually, this is a part of the strategy that is being unfolded by the government to help persons to normalize the conversation relative to mental health and wellness. Of course, persons have heard about NCDs, non-communicable diseases, and that is where we focus on physical health and well-being. But a part of that conversation, beyond the physical health, is the mental health of a person. At the end of the day, a person is a whole being. They're not just physical, they're also mental as well. So the Check My Bias campaign is a strategy that has been unfolded over the last year or so, spearheaded by Mr. Lewis and the team at the psychiatric hospital, who have been going out there to have these conversations in many different settings. So yes, we're doing it at a national level, but we're also having it within communities as well. Just this Sunday, we had a conversation within a small community setting in the Croizat Resource Center, where we were able to bring persons in and to talk about my mental health and you. So we can actually have persons realize that mental health is not just about mental illness, and we have to separate those two things because persons use them interchangeably, but to understand that mental health is something that affects each and every one of us. So beyond that, we're also increasing our resources relative to mental health and wellness. We are expanding our clinics. We have introduced within the national framework many mental health and wellness within the workplace, what we call workplace mental health and wellness. And we're encouraging employees and employers to understand that within the workplace where we spend most of our time, mental health is also one of those things that we have to take very seriously beyond the physical wellness of the employee.
What's some of the feedback that you're getting from these programs, these outreach programs?
It's been quite positive, and I think Ryan would have alluded to it earlier. There seems to be a greater acceptance of the concept of mental health, understanding that it is not just about mental illness, which I would have said it this way on Sunday. All of us are on a continuum when it comes to mental health. Most of us on a daily basis cope very well with the stresses of life. So we are in a good state of mental health. Sometimes, unfortunately, there are situations and circumstances that come our way, curveballs, life. We say life happens. And depending on how severe that incident is or that situation is, you may go from having very good mental health to be in a place where your mental health starts to waver, starts to become shaky. If that deepens and it goes unchecked, if it goes unresolved for extended periods of time, you can then go from having good mental health to gravitating towards what is now mental illness, where intervention may be necessary. And it may go as far as institutional interventions. So because all of us are on this continuum, I think persons are now embracing the fact that mental health and wellness is not just about the institutional side of this conversation, but it is how do I balance my life's activities? How do I balance my life? How do I cope with, for example, perinatal mental health? How do I cope with the birth of a new child? How do I handle the transitions that come with that? How does it, the stresses and the strains that may put on your relationship, etc. How do I handle those curveballs? So I think the conversation is becoming a lot more normal. And as a government, we have been adopting this strategy of trying to have as many conversations, because I've said it repeatedly, it's about normalizing conversations about mental health. We have to make it something that is very topical, not just from the perspective of being popular, but also so that people embrace the fact that this is something that affects all of us. And it can affect us at different stages of life, no matter where we are, different phases, different stages. We have to understand that all of us are on that continuum of good and balanced mental health.
Okay, Andy, how is your organization working with government to help break the stigma?
So really and truly, the Pan-American Health Organization, because we are set at a regional stage, we also work down at the country level. So I'm going to start first at that regional level, right? So when every year the countries come together, and on this, in September thereabout, and they make decisions. They make decisions on key issues that are impacting on the health of the people in the Americas. And in there sits mental health. And as Minister was saying, and the panelists before, that this is, when you look at the dimensions of health, health is not just the absence of disease, right? But you're looking at the mental, social. I like to talk about emotional well-being, spiritual well-being, because when you start to talk about dimensions of health, and so that's one place where we work with countries to say, to bring to the fore, these are the issues. And then we set those norms. We set those normative guidelines. Not we, PAHO, because PAHO is that's a wrong language construction, but you know what I mean, right? Yes. PAHO represents the countries. The countries equals PAHO. So the countries come together and say, this is the agenda, this is what we want to fight for. Then now when it comes down at the country level, those big normative frameworks that we decide, well, for example, Minister was talking about the perinatal mental health and guidelines around care for antenatal and postnatal patients. So when those kinds of guidelines are created based on the best evidence, we then come down and work with the countries in your context. How do you see this being translated in a way that the people can understand, can appreciate? So it's really multi-levels. Big level, looking at what the evidence is saying, drawing from experiences across the world. And then countries coming and agreeing, this is the agenda, this is the agenda for the Americas, this is the agenda where resources can come in too, where we set the direction, kind of like stewardship, steering that ship in the right direction. And then down at the country level, now that you've made that commitment on a global stage, how do you want to make it happen on your own?
Okay, well, we have some questions coming in from the audience. I'm going to put up the first question. What can we do as a community to offer support for persons dealing with mental health issues, particularly those who are hesitant to seek help. And this is from Jeremy. I'm going to throw this out to the panel.
If I can. The first thing is to be empathetic. As a community, I think that Barbadians are some of the most loving persons you can find. I think that is what has drawn people to our shores for many, many decades. People always talk about the warm and friendly nature of Barbadians. But there's another side of Barbadians. Sometimes we can be a bit rough with each other. Even as young people, we roughhouse, and our words can sometimes cut very deep without even realizing it. So if there's one thing I can say as a community, the first thing we can do is we can embrace empathy. And that's why I said, as we normalize the conversation about mental health, persons will realize, had not for the grace of God, there go I. I could be suffering in a similar way if something were to happen to me. I give this example. I spoke to someone very recently, and they were going along their merry way, living life, having a good time. And then something happened, a very significant traumatic event took place in their life, just in the moment of a blinking of the eye. And after that, that person's entire world went upside down. They started to go through depression, anxiety, fear. The trauma was real for them. And it reminded me of how fragile life is, and how fragile as well our mental health is. Because before that incident, the person was perfectly good. Now, if there's no intervention in that person's life, and they cry out to someone for help, someone in their community, and the person responds with, man, that's a small thing, get over that. If that had happened to me, I would have been able to get past every sense. That is not the empathetic type of response that we want. So we want to encourage persons within families, within community groups, within neighborhoods, that when you see somebody that's going through something, instead of taking out a camera and filming them when they're at their lowest moment, I want persons in Barbados to embrace that individual, to find a way to demonstrate the care and love. The care, the love, and the warmth that Barbadians have been known for. I want us to be able to exercise that on a daily basis, especially as it relates to mental health.
I could follow up on that one. Okay. So I'm going to add another word to the mix, right? And one of the panelists from the previous segment before the break mentioned compassion. Mm-hmm. Right? And sometimes, Minister, I think we could have an interesting conversation on the difference between empathy and compassion, right? But why compassion? Recently, the World Health Organization actually created a document on the role of compassion in care. And I was so happy when I saw it because, when you're talking about people-centeredness, and this is not just in the care setting, this is just in society as a whole, as you're making a point, right? That compassion is from here. And when I work with so the community, I can talk about, let's say, the community of healthcare workers, for example, right? And who is a healthcare worker? A healthcare worker is someone, even a volunteer, paid, non-paid. When you look at the definition of what constitutes a human resource for health, it's very, very broad. But that compassion and distinguishing between care and service, when I tell you, if you're my family or my friend, and I say, I care for you, you feel it, right? Mm-hmm. How do I demonstrate that care? By the things that I do for you, the services. I could do the same things and you don't feel my care.
Mm-hmm. True.
So, that care, compassion, empathy, that kind of space is where I think communities need to come into. Even the illness and disease, right? Illness is an experience. I can feel ill. I don't necessarily have to have a label of a disease. And so the illness and disease experience, the spectrum that the Minister was speaking about, bringing awareness. There's some studies that a long time ago that would have shown that knowledge, sharing information only as a means of, with the intention that if I share information, my knowledge base will increase. There's very a small amount of behavior change that comes as a result of just knowledge sharing. So I think as communities, we need to push that boundary. What are the other things we need to do to so that we really embrace this compassion and this empathy?
Mm-hmm.
Yeah.
Okay, we have another question. Yes, they're coming in quickly. What are some of the most common life circumstances that can potentially compromise mental health? And how can persons take a proactive approach to taking care of their mental health? And this is from Tracy or Pounder. Ryan, can you start us off with that one?
Definitely. So that's a very good question, and I'm glad that question was asked. Mental health, again, as the minister said, is just on a continuum. So mental health can begin as from the time you're extricated from the womb. You have to understand that there's a myth that surrounds that children do not understand what mental health is, and they keep relatable terms when they explain what mental health is. Your thoughts, your emotions, and your behavior. How we think influences how we feel, and how we think and feel influences how we act. So if you have negative thoughts, negative emotions, negative behavior, positive thoughts, positive emotions, positive behavior. So throughout life, going into school, new and unexpected mothers or parents for that matter, sitting in an exam, going for an interview, being told that you now have a new diagnosis, hypertension, diabetes, migrating, experiencing loss, being in a car accident, going to a job interview, being told no, being not bet on, not having opportunity. And these are all situational things. These are all life-changing events that we go through as ordinary people. I haven't spoken about the environmental factors. I haven't spoken about the biological factors or the other medical factors. I'm speaking about everything that each and every one of us as citizens, as human beings in this world, can experience throughout their life expectancy. So when we really put it like that, then it really then hits home the point that mental health is all of us. So then why are we making this thing about mental health and mental illness such a big thing, as if it's a starting and effect? Like, oh my God, you're different, you're largely different. Like, so, I mean, when we humanize it, when we realize, you know what, this could be me, and this is the empathy that the Honorable Minister was saying, is that when we treat that person and accept that person as opposed to the diagnosis, we separate that and give that person hope that you don't have to be defined by your diagnosis. That we can see you as an individual, you're going through a rough patch, but I'm going to support you. I'm going to care for you. And this is the compassion that Andy was speaking about. Because that could be me. And if I were in that situation, I wouldn't want anybody to leave me on the street or leave me to run afoul or deteriorate. And then I only reach a mental health care institution at my breaking point or when I'm fully deteriorated. Because that separates me from providing for my family. That separates my family from knowing the true version of who I could be in society. It really separates me from being productive in society and giving and having purpose beyond productivity. Because then I'm not my best self, I can't give of my best self. And of course, persons get this false narrative of what mental illness is when we only see them at their worst point.
That's a very good answer, and I hope that you received the answer that you wanted, Tricia. Next question that came in is across-the-board training necessary for managers and leaders so there is better understanding of mental health issues? And this is from Linda. Minister, can you lead us on that one?
Yes, I believe that people do need to be trained across the board when it comes to better appreciating and understanding mental health and what is entailed in helping persons when they are experiencing challenges relative to mental health and wellness. As I said, there are a lot of policies that are being unfolded as we speak. The workplace mental health policy is one such strategy, but it really is for the key initiatives that the psychiatric hospitals lead right now is called psychological first aid, PFA. And that is to really help persons to understand that in a traumatic experience, at a time of emergency, when something happens, persons will not only suffer, in some cases, physical injury, but there is a very good likelihood that that traumatic experience will also evoke mental injury, even emotional injury. So psychological first aid is one of those training programs that allows persons to become first responders of sorts. Right now I think it is the policy of the government to train at least 160 persons per year under this psychological first aid program. And I've asked the team within the psychiatric hospital to expand that because I think greater numbers of persons need to be trained per year. And we're targeting in particular, through this new approach, we're going to be targeting some of the frontline persons. So your police officers, your firemen, EMTs, etc. Persons who definitely interact with persons when they're in a crisis type situation. So we want that when a police officer, for example, approaches the scene of a crime, that person not only assesses it from their police training perspective, where they say, what happened here, what are the facts, what are the details, gathering information, gathering evidence, but that when they see a person off to the side who's crying, because maybe the incident involved maybe the loss of a loved one, that police officer now knows how to approach that situation in a more empathetic and compassionate way.
Okay.
And with that training, to be able to then diagnose the situation and see where they can then divert attention, where they need to probably, point the person in the direction of other services. And this is where the directory of services that we have created for mental health. We have a directory of services within the psychiatry, also within the Ministry of Health and Wellness, that allows persons to be able to say, I am not the most equipped person to deal with this situation, but I have a directory of services here that includes Ministry of Health and Wellness personnel, that includes persons within the private sector, that includes NGOs and civil society, a full directory of all of those who are in the mental health space, so that after I diagnose the situation, I can then point you towards somebody who can then go further in giving you an intervention that can address the situation and keep you in good mental health.
Okay, I wanted to ask first, before we go to the next question, is this training part of PAHO's programming?
So yeah, again, so all of it is grounded in this mental health global action plan. So you find that in there are these guidelines that, again, they're very broad and very general, but when it gets tailored into the country context. Yeah, and what Minister is speaking about, the spectrum of persons who get trained, who get oriented to be able to intervene in the right way at the right time, so you don't miss an opportunity to connect someone to care. Yeah.
Okay. Yeah. Okay, next question. If a person has a mental illness, insurance companies in Barbados reduce insurance coverage. How can that be changed? And this is from At Life with Risi.
This is another policy question. It is not straightforward in that what the insurance companies do right now largely has covered physical ailments. So health insurance, life insurance is usually covered physical ailments. There are some insurance companies that do give coverage for certain mental health related services. I have embarked upon a process of seeking to see what the landscape offers at this point in time. And we are very soon going to have a conversation with the insurance companies to see how we can broaden the range of services, the range of care that's offered for persons relative to mental health and wellness. Because I do not think that a person who has a mental illness or a mental health challenge should be disadvantaged when it comes to insurance. I think that if we're normalizing the conversation, if we're serious, we have to have a Barbados where even all insurance companies provide some level of care, some level of service, some level of product that will cater to mental health challenges that persons encounter. So whether it is a reimbursement, just like we do reimbursement on certain medical procedures, a reimbursement for counseling services that you may engage, it has to be something like that that allows the person to be able to access the care that they need without feeling that it is not affordable, without feeling that it's prohibitive in some way on their pocket, and therefore they're restricted from accessing it. If we want to help people to have strong mental wellness, employees, just general citizens, we have to have a broader conversation about what would allow persons to have the affordability to be able to access that care.
Okay. As I know, you've been doing a lot of work. You've mentioned the programs, the training and stuff. And I'm not exactly sure where your target audience starts and where it ends in age groups. Are there programming or is there messaging going out to children and into schools? Because yes, we can talk to the adults and try to get them to change their mindsets and open up and speak and see that this is not a problem. This is something that they can talk about and they can, work through it. But I still think we have a duty or an opportunity to touch children, so we can, start from that age group up. Is there anything going on with the children within schools?
I can probably start with policy and then let Ryan come in terms of practice and operationalization. There's right now the ministry is embarking upon a complete overhaul of a few things. One, the mental health legislation. The mental health legislation is going through a complete reformation right now as we speak. And very shortly we're going to be coming to have public consultations relative to what is proposed in this new look. This 21st century view of mental health legislation. But beyond that, the ministry is right now working on an entire adolescent health framework and system that will cover every aspect of adolescent health. And within that is adolescent mental health. So from a policy perspective, we are at this point in time with support from our various partners, PAHO and others, we are trying to craft the Barbados of the future. We're trying to make sure that this Barbados is a very inclusive Barbados. It is one that does not leave any citizen to the side, whether they're a child, whether they're a woman, whether they're a man. It does not matter whether they're an elderly person. It does not matter. Everyone who is a citizen in this country has to feel valued and is valued, and therefore our policies, our frameworks, and our legislation has to cater to that. So the adolescent mental health framework is a part of the entire adolescent health protocol and policy that is being worked on as we speak. But I'll let Ryan speak to some of the operational sides of it.
So definitely. So we also have a lot of outreach activities that are catering to the youth. Quite recently, we had a health fair on April 5th, and that was spearheaded by one of our consultant psychiatrists, Dr. Sue, and that was held in Golden Square, and that was catering to the youth. We also had a youth poetry competition, a medium for where they can express their emotions, and that was a good opportunity to see where their thought processes are at. One good way sometimes when you can't really focus your emotions or really express it, you can really write it down and start to say it, like how I am feeling. And that's really caters to a different, how we can design some school programs. So it's one thing that we've been trying to do is to get into the schools, and without necessarily calling it mental health, we look at the proponents of mental health, things like emotional awareness, things like emotional regulation. Recently, we know we've been battling things like bullying in school. We've been seeing violence and the uptick in the younger generations. And sometimes when persons cannot really name that emotion, what they're understanding, that chaos and that confusion really leads to some of our basic voices, which is anger, how we express it. Sometimes that anger is displaced because there's no avenue to really healthily express that emotion, and we're trying to find avenues and niche ways for persons to advocate for that to occur. Other things that we've been also doing is partnering with some of the other NGOs. So persons should be aware of like Let's Unpack It, one of our youth-led national non-governmental organizations, and they have been very instrumental. We've been partnering with them on some occasions on some projects, and they have been able to get persons to ignite the conversation at their level, because sometimes you don't want to speak all academia, you don't want to speak all policy. Sometimes you just want to get to some real life experiences of what these persons and what this demographic is experiencing. And it's to understand them. We got to understand that words do matter. So what we grew up understanding for a particular word, it may have a different context and meaning for them. And we're realizing that that demographic, they're speaking more about mental health. But adding to that, we want to be able to allow them to foster resilience, because there are some things that you have to go through in life. Loss is one, and being told no is one. So you need to be able to navigate that emotion and in a healthy way as well. So there are some things that we're doing, and I'm pretty sure lots more will be coming into operation.
Well, we are running low on time, so we're going to get ready to wrap up. We have one final question, and I'll invite you to, give your final comments while answering. I'll throw this out to the whole panel. I'm especially concerned about the connection between drug abuse and mental illness, especially among teenagers and young adults. What initiatives are there to address this? I'm sure you could speak from a Caribbean perspective as well.
Well, I mean, the mental health global action plan and the initiatives that it aligns in terms of bringing mental health into the first level of care, that primary care, that community-based setting. That's the space, because that's the place where the kids go, the parents go, they go to get their vaccines. There are studies which show that among 50% of persons with mental health issues, among persons with mental health issues, 50% of them had symptoms at age 14. And 70% of them had symptoms at age 25. So if one of those interventions is making that service or that care or that awareness in the healthcare team at the place where you see them most, in the community, at schools. So you have, for example, teachers getting trained in terms of being aware of recognizing signs of mental health illnesses. The nurses in the community is not a specialized service. So that's one of the key interventions that I would talk about.
Okay, Ryan?
Final thoughts?
Yes.
So I just want to say that mental health care does not begin at the hospital. It begins in your family, in your homes, at school, at work, and it just basically starts with a question. It basically starts with a genuine concern for humanity. Are you okay? And genuinely and intently meaning and asking that question. And of course, I mean, this is everybody's business. It's just not me, the professional. It's just not the minister in government. It's not just the specialist, as Andy is saying. It's about every person, every citizen in our society to play their part. And if everybody can start to play their part, we can come together with some real solutions as opposed to being behind the curve all the time, but instead getting ahead of it and curving things and making our Barbados society more resilient. I mean, we just came out of COVID, and we need to inventory what happened, what occurred, what does it mean for me, what can we do next that is better and be better prepared. So I just want to say that mental health is health, and it's everybody's business.
Minister Ishmael.
Well, just to reiterate that mental health is one of the core focus of this current administration. We have allocated about $38 million towards the psychiatric hospital and the delivery of mental health care for this financial year that we're in right now. And over the last 3 years, we have increased that amount. So it's averaged around $35 million over the last 3 years or so. That's a significant amount of money that's being injected into seeing how we can best help our persons to navigate the mental health space. So this is not something that we're taking lightly. The fact that we are revamping aged-old legislation, mental health legislation, and the way that we're approaching this revamp to the mental health legislation is to make it very patient-centric, where the person is going to have, the individual is going to have far more control over their care program, their care plan, how it is executed, who's involved, etc. Very patient-centric, very citizen-centric. So mental health is something that we're taking very seriously as a government. We want the people of Barbados to take it very seriously as well. This is not about laughing at persons when they have a mental health challenge. This is not about shunning people when they have a mental health challenge. None of those approaches is what we're asking for. We're advocating for our people to be empathetic, compassionate, and to work with each other. If you see somebody in your family or your workplace that's having a challenge, have the conversation with them. If it is beyond you in terms of the counseling or the conversation that you are having with them, if it's beyond you, then there are resources that are available from community health clinics within all of our polyclinics. All of our polyclinics have mental health clinics. The psychiatric hospital has an assessment unit. The Queen Elizabeth Hospital has a mental health clinic as well. So there's significant resources in terms of infrastructure that is available to the people of Barbados. And beyond that, we have a hotline, a totally anonymous hotline like Flying Barbados that persons can call in if they themselves are experiencing a challenge, and they can have a conversation with somebody on the other side of the line. You may not be able to talk to your mother or father, but you can call the Lifeline Barbados and you can have a conversation with somebody who can be compassionate, empathetic, listen, and give you the guidance that you need to navigate whatever the mental health challenge is. So just to reiterate, we have put the resources there, and we are putting resources and additional resources to strengthen our mental health service delivery for the people of Barbados.
Okay, well, this was definitely a healthy conversation. And as we come to the end of today's panel discussion, I want to thank each and every one of our guests, those who shared their professional insights, and those who bravely shared their personal stories. Your voices are vital in helping to break down the stigma around mental health. We've learned that seeking help is a strength, not a weakness, and that healing begins with understanding, empathy, compassion, and support. To everyone watching and listening, if you are someone you know is struggling, please know that you are not alone. There is help out there and there is hope. You can call the Ministry of Health and Wellness's hotline, Lifeline Barbados, at 536-4500. Let's continue this dialogue beyond today. You can still continue to send your comments and your questions on the thread below the Facebook feed, and we will be sure to pass on the messages, pass on the comments, and try to get some responses for you. Share what you've learned. Check in with the people around you. And remember, mental health is health. Thank you for joining us. Until next time, take care.